The maintenance and improvement of heart health are both significantly aided by physical activity. The heart is strengthened, circulation is improved, blood pressure is lowered, cholesterol levels are reduced, and body weight is managed more effectively when regular physical exercise is performed. Due to the cumulative effect of these advantages, the risk of cardiovascular disorders, including but not limited to heart attacks, strokes, and high blood pressure, is greatly reduced. An in-depth look at the ways in which physical activity can promote heart health, as well as the forms of physical activity that are most beneficial, is presented here. Exercising has several positive effects on the heart. Improves the strength of the heart muscle. It is true that the heart is a muscle, and just like any other muscle, it gets stronger with consistent muscle usage. Exercise, particularly cardiovascular or aerobic exercises, has the effect of forcing the heart to pump more efficiently, which in turn enhances the heart's capacity to distribute oxygen and blood throughout the other parts of the body. The strain that is placed on the heart is reduced when it is stronger because it is able to pump more blood with less effort. Brings down the blood pressure. Chronic hypertension, often known as high blood pressure, is one of the most important risk factors for cardiovascular disease. It is through the enhancement of the cardiovascular system's efficiency that exercise contributes to the reduction of blood pressure. A decrease in the pressure exerted on the artery walls is one of the factors that contributes to the maintenance of a healthy blood pressure range. This occurs as the heart and arteries become more effective at moving blood. Improves high-density lipoprotein (HDL) cholesterol quality while lowering LDL cholesterol. The reduction of low-density lipoprotein (LDL) cholesterol, also known as bad cholesterol, is one of the ways in which exercise helps manage cholesterol levels. LDL cholesterol is a type of cholesterol that can build up in the arteries and cause atherosclerosis, which is the constriction of the arteries. At the same time, physical exercise raises levels of high-density lipoprotein (HDL) cholesterol, also known as good cholesterol. HDL cholesterol assists in the removal of low-density lipoprotein (LDL) cholesterol from the arteries, hence lowering the likelihood of plaque accumulation. Allows for better circulation. The synthesis of nitric oxide in the blood vessels is increased by regular physical activity, which has the effect of relaxing and widening the blood vessels. By doing so, circulation is enhanced and greater blood flow is made possible, hence lowering the danger of blood clots, which can lead to cardiovascular events such as heart attacks and strokes. It helps with managing one's weight. In order to keep one's heart healthy, it is essential to keep a healthy weight. Due to the fact that it raises blood pressure, cholesterol levels, and insulin resistance, excess weight, particularly around the abdominal region, is associated with an increased risk of cardiovascular disease. By assisting in the burning of calories, the development of lean muscle, and the acceleration of the metabolism, exercise helps to contribute to the control of weight and reduces the risk of heart-related disorders. It brings down inflammation. One of the most important factors that contributes to heart disease is chronic inflammation. Through the reduction of inflammatory markers in the body, which can help prevent the development of atherosclerosis and other cardiovascular diseases, regular exercise brings to a reduction in inflammation. Different kinds of physical activity that are beneficial to the heart. All forms of physical activity have the potential to be beneficial to the heart. However, there are specific types of exercise that are particularly successful in supporting cardiovascular health. Exercises that are aerobic, cardio. When it comes to boosting the health of the heart, aerobic workouts, also known as cardio, are the most effective. By increasing the rate at which the heart beats and the rate at which breathing occurs, these exercises improve circulation and the delivery of oxygen to the muscles and tissues. Running, cycling, swimming, dancing, rowing, and brisk walking are some examples of physical activities. These workouts have a number of benefits, including strengthening the heart, improving endurance, lowering blood pressure, and improving circulation. In terms of recommendations, the American Heart Association suggests that individuals engage in aerobic activity of at least 150 minutes per week at a moderate intensity or 75 minutes per week at a vigorous high intensity. Resistance training, also known as bodyweight training. By assisting in the development and maintenance of lean muscle mass, strength training contributes to the general metabolism and the reduction of fat. Additionally, it enhances the body's capacity to utilize insulin, which assists in the regulation of blood sugar levels and lowers the likelihood of developing diabetes, a significant risk factor for cardiovascular disease. Lifting weights, performing exercises using only one's own body weight, such as push-ups, squats, and lunges, and using resistance bands are some examples. Improves muscle tone, assists with weight control, and strengthens bones and joints are some of the benefits of this exercise. Strength training should be performed on 2 to 3 days each week, with the primary emphasis being placed on the major muscle groups. Exercises that involve high-intensity intervals, high-intensity interval training, HIIT, consists of brief cycles of intensive exercise followed by intervals of rest or activity of a lower level. When compared to the more conventional steady-state cardio, this form of exercise is particularly beneficial at enhancing cardiovascular fitness and burning calories in a shorter length of time. Several examples include high-intensity activities such as sprinting, jumping rope, or cycling, followed by times of recovery at a slower pace. The benefits include an increase in heart rate, an improvement in endurance, and an enhancement of metabolism, all of which contribute to improved heart health. Include high-intensity interval training, HIIT, sessions 2 to 3 times per week for the greatest possible cardiovascular benefits. Exercises that focus on flexibility and balance. Although exercises that increase flexibility and balance, such as yoga and stretching, do not directly improve heart health, they do assist overall fitness by increasing range of motion and reducing the risk of injury. This makes it possible for you to undertake aerobic and strength exercises more successfully. Among the examples are Tai Chi, yoga, and Pilates. Increase the flexibility of your muscles, encourage relaxation, and lower your stress levels, all of which are beneficial to your heart in a roundabout way. It is recommended that individuals of varying fitness levels engage in physical activity. To begin with, as a precaution against injury or overexertion, it is vital for individuals who are new to exercising to begin carefully. To get started, try engaging in low-intensity sports such as walking, swimming, or cycling for 20 to 30 minutes on a few occasions per week. Increasing the duration and intensity of your workouts should be done gradually as your fitness level improves. The intermediate and advanced skills. When individuals already have a regular exercise program, adding more strenuous activities to their schedule, such as running, cycling, or high-intensity interval training, HIIT, can further increase their cardiovascular fitness capabilities. If you want to accomplish a well-rounded fitness plan, you should strive to perform a variety of weightlifting, aerobic, and flexibility activities throughout the week. Adults who are older and those who have conditions that were present before. It is especially vital for people who are older or who have heart diseases to engage in physical activity, but it must be done as cautiously as possible. Walking, water aerobics, and Tai Chi are all examples of low-impact activities and are great choices for improving heart health without putting an excessive amount of strain on the joints or the cardiovascular system. For the sake of maintaining a healthy heart, managing exercise-related risks. It is generally accepted that physical activity is excellent for the health of the heart. Nevertheless, persons who already have cardiac diseases or risk factors should take particular prevention measures. Get the advice of a physician before beginning. It is important to see your physician before beginning a new fitness plan if you have a history of cardiovascular conditions such as heart disease, high blood pressure, or other cardiovascular concerns. An expert in the field of healthcare can assist you in developing a treatment plan that is both secure and efficient for your ailment. Follow the rate of your heartbeat. It is essential to keep track of your heart rate while you are exercising in order to prevent yourself from overreaching your limits. You should strive to achieve a heart rate that is between 50 and 85% of your maximal heart rate, depending on your current fitness level and your goals. When it comes to monitoring intensity, a heart rate monitor can be an extremely useful tool. Understand the signs of caution. Despite the fact that exercise is generally considered to be safe, some symptoms such as chest pain, dizziness, shortness of breath, or heart palpitations may signal that there is a problem during or after exercise. If you discover that you are experiencing any of these symptoms, you should immediately stop exercising and seek medical attention. If you enjoyed this video, give it a thumbs up. Got any questions or feedback? Drop a comment. Don't miss out on our latest content. Hit that subscribe button now.